Every year, hospitals across Montana lose millions of dollars on care they provide that is not compensated. Sometimes folks who need care don't have insurance. In other cases, the insurance they have doesn't fully cover the cost of care they receive. This is especially true with government-sponsored health insurance like Medicaid and Medicare. Even so, Montana hospitals are committed to providing care to anyone who walks through their doors, regardless of ability to pay. Over time, as millions in unpaid health care is provided every year, it becomes more difficult for hospitals to stay financially viable. In 2003, when the state of Montana was facing deep across-the-board budget cuts that would have impacted crucial safety net programs, Montana hospitals stepped into the gap. Despite the losses they take as a result of uncompensated care, hospitals offered to tax themselves to help pay for the state's Medicaid program. Hospitals would pay a new hospital utilization fee, or bed tax, which is a fee applied to every occupied bed in a hospital each day. As part of the grand bargain, then Governor Judy Martz helped broker, the dollars collected through the tax would be used as the state's match to draw down federal health care funds. These funds would both offset the state's cost in funding its health care programs and supplement provider rates to bring them closer to the cost of care. Thanks to the effort, general fund dollars previously earmarked for health care could now be used to fund roads, public safety, and education. This did two things. It relieved pressure on Montana taxpayers, and it helped rural hospitals keep the lights on. Then again in 2019, when legislators worked on the Medicaid Reform and Integrity Act, Montana hospitals once again stepped up to help improve access to health care for their neighbors. As part of the new reform law, hospitals agreed to increase the taxes they pay by expanding the hospital utilization fee to include outpatient revenues. By contributing more to the state budget to increase health care coverage through expanded Medicaid, Montana could qualify for a 90-10 federal to state match. In other words, as hospitals contributed a greater amount through the hospital utilization fee, they could help the state bring in $9 in federal funding for every $1 contributed. This amounts to $190 million in new revenue per year for the state's healthcare budget. All told, it accounts for $380 million lawmakers don't need to find in the general fund every 2 years. These dollars are spent providing vital care to patients, not just in hospitals, but also at independent physician clinics, behavioral health centers, and dentist offices. In return, the state provides federally funded supplemental payments to hospitals to help close the gap between Medicaid rates and the cost of care. Without supplemental payments, hospitals would be paid roughly 50 cents for every dollar of care provided. With supplemental payments, Montana hospitals are now paid much closer to the cost of care. This helps hospitals to remain viable, hire healthcare workers, invest in new leading-edge equipment, and to hold the line on rising healthcare costs. Similar funding arrangements exist for nursing homes, county governments, local ambulance services. This model has worked well thus far. But anytime the state faces a budget crunch, lawmakers naturally look for places to cut spending. Now more than ever, it's important that lawmakers understand the important tie between the hospital utilization fee, the hole it fills in the state budget, and the supplemental payments that keep our hospitals viable. If you pull the threads that are woven together to create our healthcare system in Montana, it could unravel our entire safety net and place our state's rural hospitals at immediate risk. The supplemental payments are recognition by the federal government that our hospitals are underpaid for the services they provide. Preserving these payments protects our healthcare system at a time when we need it most. Hospitals are here for you, and the supplemental payments are designed to ensure that they will be here tomorrow to care for their communities.